So guys, today we are going to be starting season 2 with Dr. Ian Philp, MD, CBE. He's a World Health Organization advisor for older adult care. Ian has been involved in various television programs, including How to Live Longer and The Young Ones, and was the National Clinical Director for Older People in England for 8 years. Professor Ian is the founder of Aged Care Technologies, which won the 2021 United Nations WSIS Prize for Innovation in Healthy Aging. Today, we will be discussing the unreported needs of older people and how aged care technologies will transform aging globally. So, hi, Ian. I hope that you're okay today and that you're feeling positive. And I don't know about you, but the weather's rubbish here. So I hope it's a bit better where you are, but I don't know.
Yeah. For a Monday, I don't feel too bad. I work in a co-working space with a gym attached now, so I feel good. I've done my spin class, I've done my yoga at lunchtime, so I'm totally chilled. Thanks, Rosaria.
Brilliant, amazing. So let's get cracking. So how did you transition from medicine to focusing on healthy aging and aging in general?
Yeah, well, I wasn't sure that medicine was for me for the first couple of years at medical school until I discovered what's called geriatric medicine. And I worked for this brilliant professor who was my inspiration, a guy called Jimmy Williamson. He'd been George Orwell's personal physician, and he had this very humane and very practical approach to care and medicine, and he helped really create that specialty. And I decided, even as a medical student, I'd spend my career in older people's care because of Jimmy.
Brilliant. So that's really interesting. So I just wanted to quickly touch on geriatric care and health, and what I think that as a word, people kind of go, ooh, geriatric. And I know that when I've had these conversations in the past, people haven't tended to like to be referred as geriatric. Is that your personal experience, or could you go into that a little bit more?
It is. I mean, I'm using that phrase because that's what was used in 1980 when I was a medical student. We really talk about the health and care of older people now, and that's based on surveys of how older people like to be referred to. So yeah, I worked eventually as a consultant specialist in that specialty, specialist in old age care. Yeah, for terminology, geriatric sounds awful, doesn't it?
Yeah, I don't think
nobody wants to be a geriatric.
No, they don't. Okay, so you've recently been awarded this amazing prize and obviously received this recognition for aged care technologies. I wanted to explore that and what aged care technologies does, how it came about, and kind of the future of it.
Yeah, well, aged care technologies is my way of trying to solve a problem which Jimmy Williamson gave me when he retired in 1986. So I did my first job with him as a medical student with him, and I got to know him well. And when he retired, he said to me, Ian, I found a problem which I didn't solve. And the problem was that 2/3 of the things that most threaten older people's health, independence, and well-being are not reported to their GPs. And that leads to all sorts of unnecessary suffering. And he said, Ian, I didn't discover the problem. I didn't find the solution to the problem. He found the problem, published this in 1963, believe it or not. Wow. So I've spent my career solving that problem. And over 30 plus years, I've been doing research and development with colleagues around the world. We've worked in 50 countries, all regions of the world, to come up with a practical tool that helps older people report their needs and then connects them to local resources that can meet their needs. And we found we can do that everywhere. In rural Uganda, in tower blocks in Hong Kong, older people, if they're encouraged to report their needs, and if we build up a picture of the services that sit around them, we can meet their needs, and we can add at least one extra quality life year, a year of good quality life, not extending life, but adding an extra year of good quality life, and then reducing the time that older people might be, seen as geriatric or frail and needing care prior to their deaths. So we've proven the method, but to get it out to the world at scale, I decided I'd take a business model through a social enterprise. And our goal is to significantly improve the lives of 100 million older people by 2030 through uptake of this tool. And that's why I've set up Aged Care Technologies about 2.5 years ago to be the vehicle for doing that.
Brilliant. So, for example, say I am going to report my needs, what my problems are. How would I do that? And once I have done that, how fast and efficient is that process for referring the most appropriate services?
Yeah. Well, what we found is that we can offer a self-assessment and then a list of local resources, but generally older people need somebody to take them through and to hold their hands or navigate them towards the right services. So we work with health and care systems through local government, through the NHS. We work with care providers and we work with professionals who can then use the tool and use it with older people to go through the assessment and then to support them in finding access to resources. And generally it takes about 3 months, to your question about the time, to make all the changes. And then to do a reassessment to find out what happened and has life improved and is there anything else. But what we've got is actually a structured assessment with 56 things, believe it or not, 56 top things, that all of which could be fundamental to an older person having a good quality of life and living better, living more healthily and being more independent. And what we find is that having gone through the assessment, typically an older person will report between 8 and 12 concerns. So quite a lot of things. This is things like loneliness or pain or feeling that you're a burden or having had a fall or worried about your finances or your house. So it's a broad assessment. At the end of that, although they might identify 8 to 12 concerns typically, they will usually say, I only want help right now with a couple of things. And that's where you focus the intervention on the thing that actually matters most to them at the time. And so we go from very large down to just a couple of things normally, that is the thing that really will make a difference to that person's life at that time.
Brilliant. So Mature Movers is the company that I run. It's also the name of this podcast. And Mature Movers is all about getting people active so that they can promote their better mobility, better quality of life, but focusing on health and mainly exercise. And I've been working with care homes and care industries and older adults for a while now. And the 3 things that always stand out to me are being worried that they're a burden. So I love to use Brenda. So Brenda is one of my long-term friends and also clients. So she's 90. She turned 90 this year, and we've grown together as just friends, and it's been really, really interesting kind of trying to help her, because although my background is exercise and fitness and sports science, it's a lot more than that, and what I do is aimed at helping people. So it's absolutely fascinating how common it is for older people to think or worry about being a burden or stressing about, I mean, I'm sure you know GAD. So GAD is so common in older adults, and I try to explain that to so for the people listening, general anxiety disorder. So is so common with the people that I work with, and I think being an exercise person, you and a fitness professional, you and your clients build these relationships that are extremely trustful, and they share their kind of deep concerns and thoughts and feelings and what's going on in their lives, and I think that's definite. I love that approach of finding out all the problems, because everybody has lots of problems, and then narrowing it down to what means the most to them. Because although, like for example, I'm an exercise professional, and somebody might come to me and say, I've just had back surgery, right? And I really want to reduce that pain. And it can be really easy for me to go, okay, but if I look here and here and here, this is most important for me. But I do need to consider that your back is the thing that you want to focus on right now. And then we grow towards that. So it's such I don't know, a transferable need in a variety of aspects of life. So going to my next question, you've got, is it 56 problems or 56
Yes.
concerns?
56 concerns.
Is that going to be expanded, or do you want to kind of keep it at that number so that you can really focus on developing those services? Well, not you developing, but finding those services to help with those problems.
Well, to what you were saying earlier about, all older people are quite complicated. And when you met one older person, you met one older person, and they could have lots and lots of things going on psychologically, socially, in their physical environment, as well as in their health and their conditions and so on. So you can't reduce things too much. I did start with, let's keep it to 30. And what you could put in a little fold-away card. And I remember the first version of this assessment tool, I took it to World Health Organization European office meeting to discuss how we promote better care for older people in Europe. And there was a doctor from Kazakhstan who was there. And I showed him this little card, fold-away card that I could produce, and it was called Easy Care, C-A-R-E. That was what it was called then. And he took it from me. He said, Easy Carry. I said, no, Easy Care. No, he said, no, Easy Carry. And he put it in his pocket, which made it quite, the idea of keep something as short as possible. Now, we have added a bit over the years, and about every 5 years, I've added a few questions because these have come out of research to say if we don't ask about these things, we're missing something important. Now we've got, from these 56 things, they feed the World Health Organization recommendations for intervening with older people around care pathways in preventive care. And so we cover all of these things. So, yes, I want to keep it as limited as possible, but at the same time, you don't want to miss important things.
Absolutely. So currently, is aged care technologies fully functioning, and in what countries? And then if not, when's it going to launch so that it's a bit more accessible? Because I'm conscious that we have a lot of listeners who work in these industries, and if they hear about it, they might think, oh, actually, that sounds like really useful for us. So it'll be really great to get a bit of a better idea.
Thank you. Well, we are commercial, and we have got contracts. One in Canada with a care provider. There's a healthcare system in England that have contracted to use the approach. We're selling our tools to healthcare professionals directly with accredited training. So that's started, and these are our three main areas. We don't provide this directly to older people themselves at the moment. We work through people who are involved in providing care or promoting better health. But we've got a really big supply chain and partners in North America. We're going in with a system with a business that provides support to 1,000 organizations in America delivering care to older people. We're setting up a joint venture business in China to take out a national assessment system through their network in 24 provinces. We're working in Southeast Asia and Australia. And then in my international network, we're doing demonstration projects in countries like India and Uganda. So we do have that presence. And what I've been careful to do, though, is try to just hone and develop, improve the products first and stay small. I'm not trying to create a huge business. I'm trying to create a tool that's easy for people to access, easy to use, and easy to scale it up so we can get it out to that 100 million older people.
Yeah, brilliant. So you've mentioned that you're in North America and all of these other big places. Are you as I guess, like well known, or I guess, is England a good source of business growth for you? And if not, I'm making assumptions in my head, like, are we too small? Because the areas and the regions that you're talking about are quite large and have, I guess, more people that need more help, I guess. But I also know that the UK aren't great at providing the care, and kind of adopting these new digital strategies and things like that. So please feel free to expand on that.
Yeah, well, no place is too small. I'm very proud of work we're doing in North Macedonia, for example.
Okay, brilliant.
So, you know, it's just like every older person counts, and I think every country and culture counts. And we're trying to create an international standard. England's quite good, and I'm not forgetting Scotland, Wales, or Northern Ireland either. We've got partners there. But in England, there's a fantastic opportunity now, because the way I was involved in national policy work about finished that work over 10 years ago, but I was in national government for 10 years. And at that time, there was quite strong leadership from the centre in developing new models of care, improving the health service. The system fragmented and is now being brought together through things called integrated care systems, where health, social care, local government, voluntary and community services are getting together to try and provide better joined up solutions. And we're already secured a large contract with an integrated care system. We're talking to several others. And I think that's the way we'll get this out in England. And, you know, there are about 4 million older people who would benefit in England from this approach, which is a significant number. And if we reach them all, the saving to the UK economy is estimated to be about £3.6 billion in reduced long-term care costs. Yeah. So definitely worth doing in England.
Yeah, definitely. So I know that you're really passionate about unreported needs. Now, what exactly are unreported needs?
Well, they're things that are bothering older people, but they don't want to bother the doctor about them.
Okay.
And older people, for a whole variety of reasons, carry these assumptions that, oh, well, there's other people more important than me. There's nothing can be done about it. I don't want somebody interfering in my life. I'm holding on to what I've got. So what we do is we very gently encourage older people to come forwards. In England, the model is we ask GPs to write out to their 75 plus population living at home and say, we've got this brilliant health and care check system. If you're worried about your health, your independence, well-being, we'd encourage you to have this. And then you can have a telephone assessment or you can have a face-to-face assessment. And after that, we come in, we follow up, we do the assessment, we provide a report to the GP. And a lot of the research has been about how to ask older people about difficult things. And as you know, you've got to build that. Well, I can see clearly you develop trusted relationships with the people you look after, and you end up with a bond of affection, as you described with Brenda. And you need to build that trusted relationship with the older person. And from there, I mean, both parties get enormous satisfaction from being able to do something that could help an older person be less isolated or lonely, to recover from the pain that they're having, to feel that they're more independent, not a burden on their family. So yeah, that's how we go about bringing older people into this offer. And I do want to get it out to as many older people as possible in my own country of Scotland, as well as this heathen country south of the border in England. And in Portugal, where I think your family are from originally. Is that right?
Yeah, so my surname is Portuguese, but I would say my great-grandparents, but they're actually from Goa. So obviously, wow. Yeah, so it goes back quite a lot, and then we've moved to the Middle East. So my dad is actually born in the Middle East, born in Iraq, but and I think it must be his grandparents who are Goan. I would love to do an ancestry thing one day to find out who's from where. But yeah, so
you should. Well, we've done a project in Goa.
All right.
We haven't been in Iraq, but we've been in Iran.
Okay.
And the approach is pretty universal, because people often say, we don't care about old people as much in the UK as people do in other cultures and countries. I don't find that. I find circumstances are difficult, but there's a rich seam of connection between older people and younger people for everyone's benefit. And if we can provide a tool that makes it easier for older people to remain independent and happy and free of suffering, then it's really popular with the whole community and with families.
Absolutely.
As well as with the older people themselves.
So I just want to go back to what you said about older adults not feeling like they can share certain things with GPs because they think, either they're not going to be able to help me, or they don't think it's going to be possible, or that's not relevant. Do you think it's just older people, or do you think it's all of us? Or do you think older people are particularly wired like that, and maybe society has led, for example, millennials or Gen Z to have a different approach? I just personally know that I feel like I could tick that box in never going to the GP, or not wanting anyone else to worry about me, and not necessarily thinking that they can help. So it's interesting. I don't know whether your research has come across things that have suggested that older people in particular have that approach or have that thought process.
Yeah, well, there's about 4 groups of people that tend to underreport.
Okay.
Older people are one. People who are poor, which often goes with low educational attainment, underreport. People from some Black and minority ethnic groups underreport, and women underreport compared to men.
Okay.
So the beauty of our approach is that we can offer it to all groups, and the groups that benefit most amongst the older people are the ones who would be less likely to report. So we can help with the levelling up agenda and the tackling of the inequalities, not by denying anybody access, but by making sure that the people who be least likely to come forward and say, I'm bothered about this, because, and you're right, there's a new generation of people coming into old age, and every generation is different from the previous generation. One of my first patients was a World War I survivor, a man who'd been in the trenches, and I had to, as part of my medical student training, do a night shift as a nurse assistant. And the nurse in charge of the ward gave me a pair of gloves, and she said, this old man has got a rectal prolapse, with literally his bottom had fallen out of his bottom.
Yeah.
And I want you to go and squeeze it and pop it back in.
Oh.
And it took me about an hour to do it, because I wasn't very competent, and poor him. But during that time, he told me stories about First World War, which he said, I've never told anybody, but I have to get them off my chest before I die. And so there was that generation, there was the generation of the Second World War. We've now got the baby boomers coming into old age. And baby boomers will be much more demanding, and are much more demanding, and will come forward. But not everybody has that level of advocacy or agency about them. And as I say, if you're a poor older person, or you're from some Black minority ethnic groups, you're less likely to report things. So yeah, it's always changing. And younger people as well, of course, we'd encourage people to come forward. I mean, it used to be the case that cancer was a shameful diagnosis. It then was the case that mental health was a shameful thing to suffer from. And we're seeing a big change there, aren't we?
Absolutely, yeah.
I still think old age is something that people don't like to admit to. And part of older people not reporting is that if you report, you might feel you're going to be bracketed as an old, frail person. And you lose that sense of, I can still keep on top of my life. You and your listeners must know many people, perhaps in your own family, old people who just doggedly refuse help and continue to try to manage without help.
My dad, if my dad ever listens to this, that is my dad. That's you, Dad.
Yeah, there we go.
Yeah.
He needs to, we need to sit down with your dad and just run through this assessment. And how old is he?
54, I think.
Oh, but he's a bit young. Maybe in 20 years' time, we'll
Yeah,
sit down with
maybe.
him. That's his mindset.
Maybe
God, it
he's
makes me
older.
feel old. I'm 62.
Yeah, but then people think, oh, I'm old because I'm 60. And in my head, I don't know if it's because I surround myself with these amazing, inspirational, motivational people who are 90. And I think, oh, 60 is really young. What are you talking about? And I think so one of my kind of goals in life is to really try to diminish stereotypes around aging. And it's really hard because I'm nearly 25, and people look at me and think, what do you know about aging? And I think that in itself is ageist, but whatever. But I do see it, and I feel like, just as an empathetic person, people will make really, really off comments, just, and nobody would think anything else. For example, I'm too old to use the stairs, or oh, I can't do that, I'm too old. And I just think that age shouldn't be that barrier or that limitation. I was talking to a lady called Carol today, and I think off the top of my head she's closer to 70. And she was in a fitness class, and she said to me at the end, she said, sometimes I think, am I too old for this class? Now, this class is aimed at people over the age of 50. And I just thought, absolutely not. You're so mobile. You're keeping up with the class. I like to think that when you get to 60, you absolutely cannot kind of bracket people or put people into certain boxes, because there's an extreme range of ability after 60, and some people unfortunately just haven't been given the same life opportunities or education to better their health and well-being than others, and those that have are incredibly fit. I mean, with social media now, you can come across some amazing people, and obviously I follow them, and I think, right, my goal by the age of 90 is to be able to do a muscle up in the gym, or whatever it is. And usually people would think that that's a goal to have at 30, because that's like your peak age for fitness. But then I'm looking at I don't know, John on Instagram, who's 79, and he's flying on the rig and swinging. And I mean, for those of you that don't know what a muscle up is, it's going on a bar and swinging yourself so that you're pushing yourself up off this bar. So I think ageism is a huge part of it, and not just about other people being ageist to other people, but being ageist to yourself can seriously limit your ability, or put you off that reporting of issues and that whole process. I don't know if that's something that you've come across, or I'd love to know your thoughts on that.
It's completely true on several levels. One is the variability, the other is the expectation. It's about getting the balance right about what's right for you as an individual, and how you should maximize your own health, independence, and well-being as you get older. Because, I mean, there's no doubt that just as aging can bring a lot of great things, and generally you find that life satisfaction goes up for every decade after the age of 50. Wow. You would think it would go down, whereas at the same time the problems related to aging increase. So there's a sort of resilience that you get as you get older. And there's also something towards the end of life where you're making sense of your life, and you're looking back and you're saying, yeah, I think I had a life that was worth living. And that allows most people to accept their mortality easily at the end of life. But for some older people, life is pretty awful. And part of what we're doing with aged care technologies is recognizing that some horrible things can happen, but you can do something about it, and you can improve your life. You can have a better quality of life. And you don't need to suffer needlessly, and you don't need to be a burden. So And then in the space of, if we can remove the problems that are holding people back, then people have the chance to do things which give their life meaning as they get older, which it could be. And again, it's so variable. I remember going to a wonderful extra care facility in Wolverhampton, which extra care is a sort of a place where people can grow old, move into when they're old, but also enjoy high levels of independence and freedom, do the things that give their life meaning. So, there was one old resident who said, all my life I wanted to skydive. So that was arranged. There was another couple who got friendly. They were both widowed, a man and a woman. They'd both been widowed, and they decided they wanted to restart having sex. So they arranged for their jacuzzi sessions for them.
Oh, wow.
And although for most old people there, it was simple things like enjoying the garden, having a cup of tea with a friend. And there was an old lady, the oldest lady, who showed us around this place. I sat down with her, had a cup of tea at the end. And there was a sign in the conservatory on the wall that had the list of everybody that had lived and died in that unit since it was built. So I asked her what she thought about death, which is something I was taught to do as a medical student, because older people generally aren't embarrassed about it. And she said something that many older people have said to me before, and then she said something extraordinary. She said that, well, Dr. Philp, we're all old here. We know we're old. We know we're going to die probably quite soon. But she said, this is a place that I want to die in, because this is a place where dreams come true.
Oh, breaks my heart. That's lovely. So, and I think whoever gets those opportunities to be in those environments that promote doing things and participating things and doing those things that you've always wanted to do. Oh gosh, I hope I'm in that position. I think as a young person, my biggest fear is dying and not achieving my full potential. And that's something that really affects me as a person. And I always say to my partner, I say, I don't have enough hours in the day to get all the things I want to get done, so that by 50 I've achieved this and this, and I've done this. And I think there's also that age comparison thing that I don't know if anybody else does it, but I do it. And I look at other successful people and I go look at their age and I think, I really hope to have achieved that when I'm that age. And then the opposite, if they're younger than me, I just think, why haven't I done that? Why haven't I achieved that? Why do I not feel as successful as that? And I don't know if that's a common thing or not, but for me, that's a huge, I think it's a positive and a negative, because it pushes me and it provides that drive and motivation to do things, but then also it will affect my mental health and the way I kind of perceive myself. So yeah.
So it's a great thing to achieve what's called generativity in adult life, doing things that make a difference to your family, through your work and so on. And it's not about climbing the career ladder. It's about doing things which you think, yeah, that was worth doing. I used to have a discipline that every morning before work, I'd have a cup of tea, I'd look at my day ahead, and I think, is there anything I'm going to do today that if I had to sit down at the end of the month and say, yeah, that was a good thing, I did that, I would do it. Or is there anything I'm going to do today that at the end of the year, I might still remember? And is there anything possibly I might be doing today that at the end of my life, I'll look back on with pride? And then I would prioritize that thing over everything else I was going to do that day. Because that way you can focus on things that will be purposeful, meaningful, will make a difference. And then hopefully you will look back with pride over these things when you're old. And the negative side is, yeah, the secret to satisfaction is to have low expectations and exceed them. And the secret to unhappiness is to have high expectations and not reach them. So you do have to get a bit of a balance between being so driven that you would see yourself as not succeeding versus being driven enough to make sure that you achieve some things. So I would set yourself realistic goals around things that you think will give your life meaning and you'll be able to look back on with pride.
Well, it's turned into a coaching session. Yeah, I definitely, yeah. And I think, and that's why I love doing these podcasts and these interviews, because I learn so much from the people that I talk to. And I think that that whole intergenerational learning opportunity is so fantastic. And I know so many people who don't have conversations and deep conversations with anyone 5 years older than them, and I think they're really, really missing out. So thank you for that nugget of wisdom. Okay, so let's finish up with your top 8 tips for healthy aging. Now, I know that you've been, as I mentioned in the introduction, you've been a part of some interesting programs on the BBC and various other TV programs. Let's talk about that. And I mean, I love TV. My sister's an actress, and I think if I didn't do what I did, I would be in TV. And I don't know what I do, but something in TV. So go ahead and tell me.
Well, the thing about getting involved with TV programs, as I've been helping to design and aspects of them and then doing a bit of front of camera stuff, is that if you ring up the world expert on X or Y and say, I'm doing a TV program, can you advise me about this or that? They'll take the time to give you advice. So I have learned a huge amount talking to the world's experts about the top tips for living longer, and I can reduce them to 8 things in order of importance.
Okay, everyone get your pens and paper out.
Interestingly, it looks as though the number one thing you can do to increase your chances of aging well is to maintain good social connections.
Definitely. Oh God. Well, it's very. Well, we're going to talk about number one just for a second, because
Sure.
So Mature Movers, the business I run, is about using digital platform to promote social inclusion through exercise. So the reason I kind of came up with that idea, I did come up with that idea and kind of fully formed it, was during the lockdown period, because I had so many people come to me and say, I'm really lonely, and if it wasn't for you talking to me and running my exercise sessions and doing these classes with me, I don't know what would have happened to me. And additional to that, I had my partner's work colleague actually committed suicide, and it was thought to be related to the fact that he'd gone from having such a social life at work and having those social interactions during his job and seeing people, and that was kind of his main purpose for living, and then going from that to being isolated at home and not being in those social settings, you really lose your sense of purpose, and to him, he lost his will to live. So that was a huge eye-opener for me, and that's why I started Mature Movers, because of how social opportunities and I guess loneliness can impact somebody's well-being, not just mentally, but their physical well-being as well.
Exactly. And you've mentioned actually number 8, which is actually the wraparound tip, which is purpose. You wrap everything together in this beautiful package, which is purpose, life purpose. But there's other things sort of in the middle to pay attention to. One is very important, is clean air. And that means, not polluting your lungs with smoking, but it also means the physical environment in which we live has a huge effect, and increasingly understood now. Clean air. Physical activity is just as important as clean air, you'll be pleased to hear, and it's physical activity in the context of social engagement. And mental activity as well that can be associated with that. And then there's the whole stress and being able to take yourself out through meditation or whatever it is, and the best indicator of not being too stressed is how well you sleep. So that's important. And it's quite difficult for menopausal women because of the impact on some of them on their sleep patterns, which causes all sorts of hormonal adverse sort of chemical changes in the body and stress and consequences. So stress and sleep, how that's managed, really important. And then on nutrition, it is important how we eat, what we eat, but it's also important how we eat. Because there are some communities, for example, in Southwest France, that eat all the wrong things, but they live a very long time because eating is a social activity. They sit down, they take their time over their food. They're not eating and drinking to cope with stress. They're eating and drinking for the joy of life. And so there's something about how we eat as well as what we eat that's important. We increasingly know that our self-esteem through how we look or how we perceive we look is really important to people and affects our longevity and our health and our well-being in lots of ways. So I am now, having ignored it all my life, I'm a great advocate of skin products for men as well as women.
I mean, your skin does look great.
So does yours, Rosaria.
Thank you.
But then you've got the advantage of youth, and I need to supplement.
Okay, so if we were going to summarize those top 8 tips, so that people could kind of remember them, let's go with something between 2 to 5 words. Could you do that for me?
2 to 5 words.
Or 2 to 5 words per top tip.
Oh, per tip.
Yeah,
I thought you really had sent me a big challenge there. No, social connection, number 1, clean air, number 2, physical activity, number 2, equal, mental activity, which I didn't mention, keeping your mind going, number 4, stress and sleep, number 5, how we eat, number 6, physical appearance, number 7, sense of purpose, wraps it together.
Brilliant. Well, I could do a podcast just on those 8 things. I could do a podcast interview and just talk about those 8 things. I think there's so much to discuss, but it's really, I think the one that stands out to me most of all is clean air, because obviously, I mean, now people don't smoke as much as they used to, but there's all the other aspects of the air that you're in. I remember I grew up in London, and now I live in Kent, and my partner works in London. So he would come home and his collar and his cuffs were covered in dirt just from the air. And I was just, his shirts, he'd have to throw them away like every 3 to 4 months because of how bad the air is in central London. And obviously I know they're trying to implement low emission zones and congestion charges and things like that. But I'm also very scared that not enough's being done fast enough to look after the air and the planet that we're living in at the moment. Okay.
Let's do another podcast sometime. We'll talk about clean air and the other things.
Yeah, absolutely. We'll do that. Okay, so thank you so much for coming on to the Mature Movers podcast and sharing your wise words with us. I really, really appreciated the time that we've spent together. And I'm sure that the listeners are now thinking about all the ways to better their lives, and hopefully you've inspired somebody to change their life for the better. So just to finish off, if anybody did want to contact you or follow your journey, I don't know if you have a newsletter or LinkedIn or social media or something that you want to share with the listeners so that they can continue to be inspired by you.
Well, thank you. Being an old guy, I'm not great on social media, but I do have a LinkedIn account. Might have been where we met, I can't remember. And Aged Care Technologies has a LinkedIn account. And when we get round to it, we post occasional articles. But if people contact me, I will always follow up because, social connection is really important.
Absolutely. Networking is very important. Okay, thank you so much. And I look forward to our next podcast, maybe next year, on top eight tips for optimizing your aging life. So thank you so much. And